Hello, I'm Dr. Mike Coates, Clinical Director for NHS Lanarkshire Out of Hours Service. Today we are going to discuss urinary tract infections, often referred to as UTIs. These are common infections that can affect adults and children alike. The urinary tract includes the bladder, the kidneys, and the tube that connects them. As we said, UTIs are a common reasons for patients to seek advice or help. They can affect anyone, with women experiencing them more frequently. UTIs can be painful and uncomfortable, but usually resolve within a few days and treatment is readily available. Common symptoms of a urinary tract infection can include a need to pass urine more often than usual. This is termed frequency. Pain or discomfort when passing urine. This is known as dysuria. And a sudden urge to pass urine is also a symptom, and this is known as urgency. However, there are other symptoms that can often indicate the presence of a UTI. These may be that the urine appears cloudy, it may have a foul smell or contain blood. Pain in your abdomen, sides or back can be a symptom, and feeling generally unwell with a high temperature can also occur. Children can display quite vague symptoms including general tummy pain, being irritable, vomiting and not eating properly. Infections of the bladder, known as cystitis, or the urethra, which is the tube that carries the urine out of the body, are known as lower UTIs. Infections of the kidneys or ureters, which are the tubes connecting the kidneys to the bladder, are known as upper UTIs. There are a number of things that can be done to stop you getting a urinary tract infection. Going to the toilet promptly when you feel the need to pass urine is important. Making sure that the bladder empties fully is also good. Staying well hydrated is also important. Remember that the recommended fluid intake for a day is 6 to 8 cups or glasses of fluid. Water, low-fat milk, sugar-free drinks including tea and coffee all count. Fluid intake should be increased in certain circumstances, such as during pregnancy, when exerting yourself, such as when you're doing sports or heavy manual work, and when it's very warm. And going to the toilet as soon as possible after sex is also helpful. If you have symptoms of a UTI and are female, not pregnant, and over 16 years of age, your pharmacist can assist in providing advice and treatment. It is important to contact your GP if you have a very high temperature, if the patient is confused, there is abdominal pain or back pain, if there's blood in the urine, or if you feel your child is unwell. If your GP surgery is closed, you should contact NHS 24 on 111. UTIs can cause discomfort and be a concern. They are common, and the vast majority can be treated simply and resolved quickly. You can visit the NHS Inform website to complete the self-help guide for UTIs to assess your symptoms and determine the best course of action. There is a separate section you can access if you think your child has a UTI. I hope that you've found this useful. Thank you for watching, and I hope you stay safe and well.